So basically what SimiCase is it's a software that simulates what you would actually be doing as an SLP, whether it be in an assessment session or in an actual treatment session. And so you guys will watch me work through this case, and then you'll have your questions that you should be answering as you go along. So if you look up here, SimiCase has different tabs, and the first thing we're going to do for Jonas is take case history. Okay? Let me see if my volume's up. We can play that again.
Hi, I'm Haley. I'm Jonas's mom.
Okay, so we're going to be talking to Jonas's mom, and we're going to go over here and have identifying family information. So you're going to review the case history intake form. This is exactly like what you would do in real life. So you find the age, his parents' names, his siblings, and then you just have some basic case history information. Okay, so you get a clue about diagnosis here. Okay, so delays in almost all developmental areas. You have some developmental history. So you see here he's getting early intervention services. And so that's what we're doing today. We're going in and re-evaling him to see if early intervention should continue. Okay. So that was that form. So we're going back to the simulation, and we're going to ask.
Just English is spoken in the home.
Okay.
Jonas is the third baby. I have two other daughters. Avery is 5 and Harper, she's almost 6 and Harper's 4. And yeah, they're like mini moms. They just take care of him and get him things. And sometimes they help a little too much and like get him everything. So, but yeah, they're all like best friends and do everything together. Yeah, we do have one babysitter that's pretty phenomenal, and she's worked with kids with special needs. So we have her come in the house usually about once or twice a week for a few hours. Not a long time, but for me to get some work done.
Okay. And so now we're moving to areas of concern.
I let my pediatrician and the doctors handle the medical stuff, and we didn't worry so much with communication until he hit 12 months, because speech was mainly consisted of developing like a feeding schedule and not so much a schedule, but helping him learn to, breastfeed or drink from a cup. And then 12 months is when we decided to introduce, about 15 months is when we decided to introduce communication, because his doctor was concerned that he wasn't saying any words at 18 months. And that's when our speech therapist came back.
So just for the sake of time, if you guys see over here, it has the response typed out, so you can look through each of these. I've already done this simulation, so I know which ones it's asking you to ask the mother. So we just talked about why is she here today. This one, tell me about your concerns.
It's really hard not to compare your child to somebody else. So
you can look through this response here. And then there are some questions that you definitely wouldn't ask, like, since Jonas has Down syndrome, do you think he's going to have a severe cognitive disability? That's not how you would word a question to the parent.
So we had a therapist when we lived in Illinois, and then we saw our new...
Okay, so there's another response.
My husband and I, we both see eye to eye on a lot of things. Sometimes we tend to look too far into the future, but we don't do it at the same time. So he'll think about 10 or 15 years down the road, and it gets overwhelming, and I have to bring him down. And it's usually when I'm okay, and then there's time.
All right, so you can read the rest of her response there. Okay, This one, it's always important to
When
ask
he was
about
born,
pregnancy and delivery.
I labored for 15.
Okay.
I'm pretty lucky that Jonas is my third, because first time around, that's all you focus on is comparing your child to other kids and what they're doing. And so you expect your child to walk at 12 months because your best friend's kid is walking at 12 months. As you have more kids, you tend to not.
All right, so here's the rest of her response for this one. Okay, and then asking a question about pretend play.
The only
That's
thing I see him
important,
pretending that I can.
because pretend play is one of the skills that you need before you have the capacity to develop language. It's one of those kind of like early developing skills in your progression. Okay, so now moving on to medical.
So, brief medical history on Jonas. We found out that Jonas had Down syndrome when I was 20 weeks pregnant. And bit of a shocker.
So here's the rest of the response for that one. And we're not going to ask any more of these. Moving into feeding and swallowing because that was indicated on that initial case history form. We're going to ask about concerns.
No.
Okay. So now moving into speech and language.
With communication interactions, when we work with him, he usually gets really excited, doesn't tend to get too frustrated when I'm directing him to do something or talking with him or specifically trying to work with him. The only time I notice that he does get frustrated and he's just like had enough is typically if he's hungry or if he's really tired.
Okay. So, going to kind of fly through the rest of these, but these are the other questions you would ask in the assessment.
So Jonas communicates in his own way. We know when he's excited, we know when he's happy, we know when he's had enough. He likes to use a lot of arm motions and he babbles at the same time. So I look a lot at his nonverbal communication.
Okay, so look at the rest of the response here.
He naturally wants to please. So if he gets frustrated, I usually just back off and stop.
Okay. Next question.
When he's initiating communication, he will usually just yell at me and just go, ah, and then hand me something. So he'll just like reach and give me something, but he'll like give me a clear.
Okay. So next one.
In therapy, when I can tell that it's something meaningful, is when I'm working with him and there's no other distractions. There's nothing else around us. I'm able to actually like, hear him and know what he's doing. Like every time I open up a book and I point to a picture.
Okay.
I've heard him say mama, but he continuously says it. He'll say mama, 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 mama. Jonas follows directions best when he has something that he wants. So if I want him to crawl to me or to come here, I'll use work.
Okay, so read the rest of the response there. Now moving into social. So this is where you're getting into a lot of their daily routines. This is really important for early intervention because with EI, you're providing services in their home. So you want to make sure that you really know what a day-to-day routine looks like for these kids.
Our schedule day to day is a little chaotic because we have 3 kids. So we basically just work in any kind of playtime because I play with them. That's basically what we do, whether it's speech therapy or physical therapy. It's a lot of play. So he wakes up in the morning, we feed him right away, and then we play on the floor.
Response for that you can read through. Okay, now asking who he spends time with.
First thing in the morning, my husband helps get the kids ready for school. So they're upstairs while I'm doing work. So first thing in the morning, he spends a lot of time with Dad. And he's in between 7 a.m.
There's that response.
Yes.
Okay.
Right now, Jonas kind of parallel plays with everybody. He does his own thing, but he shares a lot. So he'll take turns with his sisters and with his.
So, side note, parallel play means that if you saw like a kid playing with some cars, you might go up next to him and also take a car and start rolling it back and forth, but you wouldn't necessarily think to actually interact with that other child and play with the cars together. It's kind of like you're doing the same thing side by side, but the lines never cross.
Friends. But mainly he just stares at them and just takes in what they're doing. You can tell his brain's working.
So there's the response for that one. Okay.
He'll take his toys and use them how he.
So there's that one.
When he's with other kids,
There's the response for this one.
When I'm playing with Jonas and we are like one-on-one and we're.
Okay, so there's the response for this one. Okay.
Jonas doesn't go to any daycare. We keep him at home. It's important for me to have him home so I can be with him more and work with him more, especially with the therapy he does receive. I need to.
All right, so that was all for the case history section, and I'm just going to see really quickly if this uploads, so stay tuned for another video.